We all hear a lot about AI tools in medicine, in particular in radiology, but actually the clinical deployment in Ireland has been very limited. And we wanted to do a study of an AI tool from deployment to clinical use, both to validate the tool itself and also to have a look at how that process would occur in an Irish setting. We picked an AI tool that looks at mammograms, which are x-rays taken to look for breast cancer in female patients. The software itself internationally has been trained on screening patients. So in St. James's, we're not a screening unit. We have a symptomatic population. So many ladies would be both older and younger than the screening population. And we'd have a lot of patients who would have had surgery or other interventions on their breast. So different than the AI had been trained on. We wanted to see, would the AIs trained on screening patients be useful in our patients? The big challenge in any IT project is getting software installed and working. Both in St. James's and across the HSE, IT resources are limited and stretched. So one of the most important things for us in selecting the tool to use was one that we could install with minimum involvement from the IT department. We were able to take a tool from Lunit, which is one of the vendors that does breast AI, and effectively deploy it inside software we already had. And that meant that all the interfacing, etc., had been done. We've been running the tool in what we would call shadow mode. The ordinary workflow has been taking place. So women who come in and have their mammograms, they've been read and acted on as normal. But we have the AI tool also reading the studies, and we will do a very rapid audit. So we basically look every evening at what the AI tool said and then compare that to what the radiology opinion was. But we certainly found two major findings. One is that there were some very small tumors that the AI flagged that had not been seen as part of the clinical routine, and we were able to confirm them when we brought the patients back for biopsy and ultrasound. And the second, even more useful, is that the AI gives us the opportunity of having a second reader. So in breast check, if you go for breast check, your mammogram is read by two radiologists, and that's the gold standard because one may see something that the other misses. But in the symptomatic service, we're not resourced to have two radiologists. So it's just one radiologist reading a mammogram. And usually that radiologist is doing lots of other things, doing biopsies, et cetera, et cetera. And so what it does is it gives us a second reader. So we think that not only is it going to pick up a few extra cancers, it's also going to decrease quite significantly the amount of people that are recalled after their first mammogram. And that'll help both in patient anxiety, but also it frees up slots because when you recall a patient, you're using up a slot that a new patient could have. And I have no doubt that this will be in clinical use in all of the symptomatic breast units around Ireland within the next 2 to 3 years.